Ouais, on va commencer. Pas de téléphone, man, comme Rabbi. So the case today of 83 years old man with a gastric outlet obstruction. We will check for the CT scan to see exactly the level of the stricture. So we see here in this view, we will follow with my pointer here. This is the stomach, the fundus. We'll go down, down, down. Before this is the fundus. And then I will come back to follow the direction of the antrum, which is here in the upper part. We see full of air. This is the antrum here. And I will try to follow the pylorus, and then we see in black there the white. This is the duodenum here. So I will go down, and I see the second part of the duodenum here. So it's not obstructed here. And if we go a little bit down, we see the beginning of the third duodenum, and we see clearly the tumor is here. So the purpose now is to go to the third duodenum. This is the level of the stricture. So we just will measure a little bit to see. I think we have 4 centimeter, 5 centimeter stricture. So our purpose to get to the stricture, put a wire to cross it and the jejunal loop, take our biopsy, and then place a stent. So we'll begin now our procedure. For that, we have the choice to use a large channel scope. We'll use colonoscope today. We will put a distal cap to help to stabilize in the third duodenum. راسه شوي. So if you want to divide our procedure in steps, I think the first one will be to arrive until the stricture, but there is one just before is to clear our view. We will have sure an esophagus and stomach full of food because of the stricture. And crossing the upper esophagus with this cap, we have a 15 millimeter diameter. I see the entrance from there, and the cap is not really helpful. I will go from the other side. So this is the first step. We cross it with the colonoscope, the upper sphincter. This is the cardia, and we are in the stomach. We have a lot of liquid here with food, so we try to clean as much as possible. And now I will try to advance my scope gently. This is the pylorus. It's usually normal to find it wide like that because of obstruction. So we'll push. Now we are in the first duodenum here. I will check from a fluoroscopy. مش اللي كنت شوية ترى. ضرب يطلعوا الطاولة شوية. So we have some bleeding here related to the tumor. So I will wash as possible. I want to clean my view. And I want to see my tumor. So I'm torquing my tube to the right position. And I have to face my lesion. So I won't push a lot because I just want to the water expand this duodenum. And we are almost at the end of the second duodenum. I'm sure my tumor is at 12 o'clock position. So I have just to turn a little bit. I see the bleeding there. I will use just my little wheel to try to face it like this. And I will pull back. We are in the short scope position now. I don't see my stricture. A lot of bleeding. And the cap will help me to just like this see my stricture. The blood is not helping me, but with the water it should be okay. So we see clearly the tumor now. And I will show you on fluoroscopy. So my first step, I will try to get inside with a guide wire. And we are clear. اعطيني في الجيد الكانيولا. هذه شد لي التيوب هكا شوية بربي. So we have to feel, I see just the entrance there. But we have just a problem of direction. And I have just to move a little bit like this. امشي في الجيترة. لا ارجع. امشي ترى. امشي. So the wire just looped. No. فيش. Is looping there, so I will try. نهد. ماهيش سي بي بربي امانك. كنت باش تدز هكاك. I have to be just in the best. ارجع. امشي. ارجع. امشي. 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 الاخر. So I think we cross it now, so I will just يجيني لين شوي بسكوبي ترى. ارجع. امشي. اقعد هكاك شوية. So I'm sure هيك يجيني لينا. خذ contrast. So we'll inject some contrast now to be sure that we are in the jejunal loop at the end of the duodenum. And we see it clearly here. So I want to just to pull a little bit my guide wire. And I want it to go straight. امشي. And I want it to go just in the other loop. اجبد. So the wire is going. اجبد. امشي. So this is what we want to have. امشي. I have to at least have 2 or 3 loops to stabilize my wire contrast. So the next step will be to measure my length of the stricture injector. So I will put a lot of contrast. This will get like this. While I have to be sure my wire don't move injector. So I think this is the 20 وبشوية مش مسيرش. انجكت في عقلك. So this is the limit of the stricture. Stop. باش بدي فيك شوية ترى. So I will push a little bit my cannula and we have to put the distal part of the stent here. I this. And I will pull back my device and just try to check. Stop دقيقة. I'm cleaning the field. I want to see the distal part. This will get. Stop. So I think we need 7 centimeters. كاش دزيت برشا في الجيد. اجبد في الجيد. اجبد. Stop هكاكا. So my wire is well placed. I have just now to fix my scope. هذه اللي حاجتي بيك راهو. So this is the best position for putting our stand. I will push a little bit my scope and just have to face my stricture. So the next step, we are stable like this. So we need some biopsy. So we will take out سنة دقيقة. I will just measure again. أقعد هكاك انت سيرش. So I will push my device. اجبد في الجيت شوي اجبد. Injecter produit. So I will put some. قاعد تسجل في تصور ولا؟ So we seek really the contrast here. And it's coming here. Okay. So we have a 9 centimeter length stand. It will be enough. I will go again. Inject it. يا عقلك. I think the structure is beginning at the distal marker of the cannula until here. So it's a 5 centimeter structure. Inject it. I want to feel all this here. Inject. C'est bon. دز في خلينا نخرجوا. عاد انجكتي ميس انجكتي. سي بون. دز فرد فيتيس. ما عنديش باش نشد ديريكتور راني فرد فيتيس. اطلق. So we have to focus now on our guide wire. We don't have to lose it. The mistake we do always is not the same speed with the nurse. So the wire can loop in the second duodenum and you will find yourself outside the tumor. You lose your guide wire, so you have to do all again. So the guide wire is okay. So once secured, I will take some biopsy. في وجهي هكا ترى. Biopsy. So 83-year-old man, really, we will just take biopsy for confirmation. I won't take a lot of sample because it will be bleeding. تعرف اش نقول لكم؟ حطوا لي ليكرون ديما حلوه هذاك. يا حله سكره 1 حله سكره. هذاك الكل خدمتكم انتم من الاول، تحط ليكرون ما تخسر حتى شيء باش تحطه. حطه من غادي من غادي، تو بجدك تو هكا تو ترى في وجهي كيفاش انا قاعد نتفرج. another biopsy and we will حله سكره. It's enough. تو البخيس بجدك تجيب في غالونج وانت الخيط قدامك غادي. قلت لك ماهيش نورمال، مش نورمال. هات البروتيز. ريما، تحب نطردك مسألة مرة أخرى؟ ركب في الوحدة قبل، ركب في الوحدة قبل، ركب غادي قبل في السوقتيم الغادي. ليه تدخل قبل ما تنحي؟ دخل بولا نحي. So we are stable here. Elle est 25 ou 35. سايب سايب اطلق برا اطلق. خرجك ولا مازال؟ تو يخرج منك فيها كيف يخرج قول لي. So I'm pushing خرج slowly my stand. خرج ولا مازال؟ So what will happen now؟ هاجر يجي دور باش تشوفها ترى غادي كش ترى في سكوبي، راك سكوبي الرسمي راهي. So what will happen? We see the loop. I will just put the bigger image in the fluoroscopy. So what we will have to avoid now, when the stent will come to the distal part, the 5 last centimeter of the tube, I will find myself pushed out in the stomach. اجبد في الجد نتاعك. I will shake on the fluoroscopy, the wire is inside. لازم الفيل جيت ما لازمنيش نوخر راني خاطر مانيش دودينوسكوب مانيش ستابل. So the stent is coming here, my loop is okay. So now the most delicate thing is to cross. We don't see the guide wire, so I have to come until the end and I have to get my distal. لا لا اغزر لي اغزر لي ريتش قاعد تعمل توا نحيت البوكل نتاعي. دز في الجيد دز. this. So we have ما عادش تعمل شيء تاني هذا. My stand is in distal part. This will get this. This will get like this. So I can release there, but I have to see my duodenal part of my stand. So I can open here because I have on the fluoroscopic view the distal part of the stent, which is now coming here. I will see it now. This is the distal part of my stent. So I can begin release here. Don't forget that it will shorten. So I pull back slowly here. There. So now the distal part is okay. We can cover. So I will just release a little bit my big wheel. And I will begin now releasing my stent. أبدأ ازاي؟ So I will do it on fluoroscopy. امشي. And we see the distal part of the stent opening. Stop دقيقة. Stop. I will pull it a little bit down because I have enough space there. حلة. And you see the stent opening there. I pull it a little bit. Stop. And this is, we are now in the level of the stricture. I will pull a little bit. I have to see it opened, fully opened there. Stop دقيقة. We wait a little bit to see if our position is okay. امشي. I will pull a little bit. I can even open it inside my channel. Stop دقيقة. Stop. So this is level stricture. So I will just pull back my scope, see where is my distal part of the stent, and it is here, almost here. واخرب سكوبي شوية ترى. C'est bon. And this is my distal part here. I will go just inside a little bit. امشي. So I will just finish releasing now. Stop دقيقة. Stop. So I see my distal part opened there. It's almost done. So I will just let you see the distal part which is here. So we can pull a little bit out here like this. امشي. And finish opening. And it's fully opened. So we are just in the middle of the stricture. And it's opened from the two part. I will take out my wire and watch to see. هبطي بس كوبيلوتا شوية ترى. So we need some water now. We see the tight stricture in the middle. We'll just bring this food out and go check again. So this is our duodenum. First, second part. Some bleeding here occurring, and we see our stent there. So we are far away from the papilla, which is here. We have covered all the lesion. أعطيني سرنج 50 produit. I won't try to cross, of course, because we can move the stand. But if I torque a little bit, this is my stand there. And it will shorten a little bit because 48 hours for opening of the stent, and we see we can go just beside the stent here, and it's okay. The papilla should be here, so we are far away from the papilla. And what we'll try to do now, just to get that contrast, to inject some contrast. And we see the contrast going there, so it's okay. C'est bon, c'est bon. So I think we are at the end of procedure. Skopje شوية. So we have to empty a little bit our stomach now. So I think the most difficult part here is to locate the stricture. Be sure that you are far away from the papilla to not cover it. The other mistake for the third duodenum is to be out of the so when you are placed in the third duodenum, you are facing your stricture. If you have a big loop in the and we see how we are feeling, it's okay. Parfait, yeah. So when you are facing the stricture and you have to unloop the scope to be in the short scope position, like an ERCP, so you have more control on the progression of your stent. If you don't have this short position, you will find yourself directly in the stomach. سجل لي هذيك هكا. We have some esophagitis here, which is normal with the outlet obstruction. Right. So we will be, of course, on liquid diet today, this afternoon, and probably we will release this afternoon also.